do you think healthcare is a right, and how does that inform the position you're taking on the resolution? Sally Pipes.
Right. Well, healthcare to me is neither a right or a privilege, as it's being talked about. It is a good, healthcare is a good and service, and like all goods and services, healthcare is necessarily scarce. Declaring a right to healthcare that is green lighting essentially unlimited demand for healthcare will not miraculously engender unlimited supply to meet the demand for healthcare. It's also unclear what a right in healthcare really is. Does it mean the right to the very best doctors, the very best care, or simply a right to equal care? If the latter, would the government have to ban people from paying for better care? And does the right to health care come with any corresponding duties? If I have a right to health care, does the government have the right to tell me, myself, that I am not healthy and that I can't have health care? Do I waive that right if I'm a smoker or if I'm obese, as in the UK? British people that are obese or smokers are having a hard time because doctors are told not to treat them. So I believe healthcare is not a right.
Let me bring the same question to Adam Gaffney.
Healthcare absolutely should be a right. It's not a right in this country because we care more about the interests of the private insurance industry and their shareholders than we care about the rights of American patients. So yes, it should be a right. It's not some, complicated philosophical question. We consider a lot of basic social services rights in this country. We think children have a right to an education. Are teachers a scarce resource in some sense of the word? I suppose. Does that mean we force kids to pay for their education, and the ones who don't have enough money don't get to go to school? What kind of a society treats these fundamental social services that we all require as no different than luxury commodities? So absolutely yes, healthcare should be a right.